According to CenterForDiseaseControl.com, in 2017, a total of 194,377 babies were born to women aged 15 to 19 years old. The topic I chose today is teen pregnancy because I feel that it is very important to know the preventions and consequences of the issue. I am able to talk to you about this topic because I'm a teenager and have been around many pregnant teens, and I've also done research on the topic. Statistics for teen pregnancy have decreased over the years. Birth rates fell 10% for women aged 15 to 17 years old and 6% for women aged 18 and 19 years old. The drop in number of pregnancy has an unknown reason except for teens just not participating in the sexual activity and more using birth control than the previous years. According to CenterForDiseaseControl.com, among 15 and 19-year-olds, teen birth rates decreased 15% for non-Hispanic Asians, 9% for Hispanics, 8% for non-Hispanic whites, 6% for non-Hispanic blacks, and 6% for American Indians. Even though many rates have decreased over the years, some factors increase the likelihood of becoming pregnant. Low education and low income increases chances of pregnancy. Also, teens and child welfare systems are at a higher risk of teen pregnancy and birth than any other group. Women living in foster care are 2 times more likely to become pregnant than those not in foster care. Now, on to my next point. Teen pregnancy is very common and comes with many consequences and preventions, with short and long-term consequences for teen parents, their children, and their community. According to youth.gov, research has shown that pregnancy and childbirth have a significant impact in educational outcomes of teen parents. Teenage births are associated with lower annual income levels for the mother. 80% of teen mothers must rely on welfare at some point in their lifetime. Teenage mothers are also more likely to drop out of high school. HealthCommunities.com states that only 1/3 of teen mothers obtain a high school diploma and only 10% finish a 2 to 4 year college program. Teen pregnancies are associated with increased rates of alcohol abuse and substance overuse, lower educational level, and reduced potential in teen fathers. Teen fathers have a 25 to 30% lower probability of graduating from high school than other boys who are not fathers. Children who are born to teen moms may also experience many issues and problems. Youth.gov states many possible issues that a child born to a teen might face. Childbirth teens are at a higher risk for low birth weight, have lower levels of emotional support, have fewer skills, and are more likely to be less prepared when they enter kindergarten. They also might have behavioral problems, and they are also more likely to become pregnant as a teen as well. Since teen pregnancy comes with many issues, there have been ways to prevent becoming a pregnant teen. CDC.gov states that about 43% of teens aged 14 to 19 years old have never had sex. More than 4 in 5, 86%, used birth control the last time they had sex. Less than 5% of teens on birth control use the most effective types. My last point is preventing teenage pregnancy. Teenagers knowing ways to prevent teenage pregnancy is very important. According to CDC.gov, IUDs and implants, known as long-acting reversible contraception, LARC, are the most effective types of birth control for teens. More teens are waiting to have sex, but for the sexually active teens, many of them use condoms or birth control, which are less effective at preventing pregnancy when they are not used correctly. LARC is safe and doesn't require taking a pill every day like birth control does. It also doesn't require doing something before each time having sex, and it prevents pregnancy 3 to 10 years, depending on the type used. Less than 1% of the people using LARC become pregnant during their first year of use. Doctors, nurses, and other healthcare providers can help give advice in preventing teen pregnancy as well. They do their part by encouraging abstinence and encouraging LARC as a safe and effective choice of birth control for teens. They offer birth control and other methods such as IUDs and more, and discuss the pros and cons of each. They also remind teens that water by itself does not protect against sexually transmitted diseases. They teach some forms of birth control, like condoms, must be used every time when they have sex in order to be effective. There are many ways to prevent teenage pregnancy, but teen pregnancy remains to be an issue. Teen pregnancy is common even with prevention and comes with many consequences. Before becoming sexually active, it is important that teens are aware of the consequences and birth control methods that are still available to prevent teen pregnancy.